Should you be on hormone replacement therapy? This is a question that I have, and I'm going to ask it today of Dr. Shafeena Premji. Hello, everyone, and welcome to Move Daily Talks. I'm your host, Tracy Steen. So this is a conversation. I know that you've probably been thinking about it. I've been thinking about it. Some of us are on hormone therapy. Some of us are not. It can be a confusing space, but this is where I'm going to ask Dr. Shafeena all of these questions. Dr. Premji is a family physician who has had a North American Menopause Society menopause certification since 2015. She's the founder and director of Mahogany Medical Clinic and the Village Medical, where she offers prenatal care, women's health consultations, and a menopause clinic. Dr. Premji is a board director of the Canadian Menopause Society and on the medical advisory board of the Menopause Foundation of Canada. She has done several local and national media interviews, as well as podcast interviews, offering her expert advice to women across Canada and across the world. I'm thrilled to welcome to the podcast Dr. Shafeena Premji. So I know a lot of you are in the menopause transition, and it can be a tricky time. There is just so much to know. I myself feel like I'm just on this constant journey of learning, and this is why we turn to experts. And today, as I've told you already, we're welcoming Dr. Shafeena, and we're so thrilled to have you here. Welcome to the podcast.
Thank you so much. It's such an honor to be here today with you.
Well, you're the expert, and this is why we've had you on, because again, like I said, I think we just have so many questions. It's actually a really great time to be a woman. I think of my mom's generation, right? And they had so little content, so little information on how to navigate this menopause transition. And so they didn't do it that well, right? Not as well as they could have. And now we have all of this information. But one of the things that I am finding is that it is tricky to navigate. There is a lot to know. And part of why what I'd like to talk to you about today is how do we break that down into real usable techniques to help us feel better throughout this transition, throughout this stage. So I know that there's a lot of misconceptions about menopause. Could you talk to us about what some of those misconceptions might be right now that you're hearing in this space?
If you asked me this question 2 to 3 years ago, my answers would have been a lot different because I think menopause is having a movement right now. And it went from something that was not discussed, it was sort of this hush hush secret that women would have to sort of suffer through, to a point now where it's everywhere and all women are wanting to talk about it and wanting to know what to do about it. Some of the most common misconceptions and myths I hear about menopause is that, number one, I think women have this daunting fear that menopause is the end of my life. Like, it is a point in my life where I am no longer useful to society. My relationship with my partner is going to be destroyed. I am going to be old, and I am no longer valued. So I think there's this huge misconception that menopause is a really dark, unwanted time of a woman's life, where the reality is that actually I see menopause as a beautiful milestone in a woman's life. And it's also a time where she can reevaluate her health, her time for herself. And also, now that women are living into their 80s, we're actually spending a third to a half of our life in menopause. And that means that there's so many things that we can continue to do during that time in our life where we can continue to thrive. So I think that's one huge myth. Another huge misconception 3 years ago is that menopause or menopausal hormone therapy is very dangerous. It's going to cause breast cancer. I'm going to have a stroke and a heart attack. To now, the main topic and conversation that I hear online and in social media is that every woman needs to be on menopausal hormone therapy. And I think those are both misconceptions. Hormone therapy is not dangerous, nor does every woman need to be on hormone therapy. So I think we really need to fill and correct that myth and that misconception, because there's so many different opinions, and it's really hard to understand the research and the published data that many influencers are bringing to the social media space. So those, I think, are the two biggest myths that I can see currently in this area.
So who do you think needs to be on hormone replacement therapy then? Yeah, such a great posing that question like that, because I think you're exactly right. We hear on social, it's for everyone. Everyone should be on it. We should take it to our grave. And then, there's my doctor who says you don't need that. So, I think there's just a lot of polarizing views. I would like to know your opinion on who you think could benefit from being on hormone therapy.
So I want to preface this by saying that everything that I'm going to share with you is based on evidence-based guidelines and data. And so I do follow the recommendations of the Menopause Society, the Canadian Menopause Society, and the International Menopause Society. And so if we look at the guidelines specifically around what menopausal hormone therapy is indicated for, number one, it is not indicated for prevention of anything.
Right.
So we don't use it for prevention of brain fog and dementia. We don't use it for prevention of heart disease. In the USA, it is indicated for the prevention of osteoporosis, but we do not
Right.
have that indication in Canada.
Oh, is that right?
We do not have an indication in Canada.
Oh, I
So
didn't
in
know that.
Canada, the
Yeah.
indication is for women who are under the age of 60 or within 10 years of their final menstrual period, who have bothersome, moderate to severe hot flushes and night sweats. That is the primary indication. So if somebody, however, comes in with many other menopausal symptoms for which there are over 30, and we know that based on a report that was published from the Menopause Foundation of Canada in 2022, there is a whole host of menopausal symptoms. And when I meet with my patients in the clinic and we do a very comprehensive menopause consultation, I ask them about all of these symptoms. So this also includes a lot of sleep disturbances where women have difficulty falling asleep as well as staying asleep or early morning awakening. I also see a lot of mood disturbances with new onset of out of the blue anxiety and depressive symptoms. A lot of women will report difficulties with concentration, brain fog, word finding difficulties, and its effect specifically in their workplace. A lot of women will report new onset of fatigue for no reason at all. Um, there are some women who experience worsening migraines in the perimenopause transition, palpitations where they feel like their heart is beating very rapidly. And sometimes that can be from perimenopause and menopause, or it could be something else. There is a lot of genitourinary symptoms that also present in this time. And usually these are the constellation of symptoms that actually worsen with time, whereas a lot of menopausal symptoms are transient. They do last for a few years, but in general, they do resolve over time. The genitourinary symptoms actually don't get better and they are chronic and progressive. So what I'm referring to is the vaginal symptoms, the urinary symptoms, and the sexual function concerns. So there are women who start reporting pain with intercourse, a decrease in their desire. There's also some dryness, a burning, discharge in the vulvovaginal area. And there is new onset of like yeast infections or bacterial vaginosis out of the blue, or even new onset of bladder infection. So like UTIs. So there's many, many symptoms that present. And the job of a menopause expert is to really understand what symptoms are bothering the patient,
Right.
what is its effect on their quality of life and their daily function, what of those symptoms are truly menopause and what could be something else. So we do need to ensure that we don't clump everything into this is perimenopause or menopause. We do need to do our due diligence to ensure we're not missing another medical diagnosis. Because I think the other thing that I'm hearing is that 30-year-olds are saying, I'm now in perimenopause and I want hormone therapy.
Oh,
It's not, as I mentioned, it's not for everyone and not everything is menopausal symptoms. So, as healthcare providers, we need to be really clear to be realistic with patients' expectations around what menopausal hormone therapy can do for you and what it cannot do for you. I think that's the primary question you're asking is who does it benefit?
yeah.
It's not a simple answer as you alluded to. It's very, very complex, and that's why these comprehensive consults take me 45 minutes because I need to really understand a woman by asking her all these questions, but not so much just asking, but understanding what its impact is on her day-to-day function.
One of the things that I just found interesting there, because I'm in Canada as well, is that you just said that it's not recommended for the prevention of bone mineral density loss. My question is and thought, okay, so personally, I am on BHRT right now. I've been for the last few months. Just part of it is because of all of the things that I've read and heard, and you want to make sure that things are lubricated and we reduce inflammation and bone mineral density. And yet, I personally have spent my whole life, the last 25, 30 years, working out, jumping, hopping, lifting heavy weights. So I'm very fit. I've got excellent bone mineral density, right? So I had a DEXA scan and I was ranked above for my age. And so looking at that, I think, well, my bone mineral is really good. I don't need hormone replacement in order to stave off the loss of that. And then also vasomotor symptoms don't really bother me. And so there's this thought sometimes as maybe we should be on hormone replacement, but I don't feel like I really need it. So from your example right there of what you just said, it seems like maybe it's not necessary for a person who's doing all the things, having some good sleep, focusing on, wellness, nutrition, and fitness. And those are really important too, because I hear you saying too, like anxiety and depression. Well, are we going to therapy? Are we moving daily? Are we getting out in nature? Are we doing mindfulness work? That's enhanced wellness. So maybe I, have kept anxiety and depression at bay. So I really, we're trying to think about for ourselves, is it necessary given all of these circumstances and all of the things that I'm experiencing? Maybe it's not.
Tracy, I think you are the prototype of what every 54-year-old woman wishes she could be, because you are doing all the things that I wish all of my patients could
Mm,
do. And listening to your story tells me that you are a patient. If I saw you in my clinic, I would not be jumping to hormone therapy for you. You have
right.
an excellent bone density. Why? Because you are doing all the preventative things to make sure that you maintain your bone density. You're probably having adequate supplementation of vitamin D. You are, having enough calcium in your diet. You're lifting heavy weights. You're being active. You're doing weight bearing exercise. You are doing all the correct things. And if you look at the 2023 osteoporosis guidelines in Canada, nowhere in the guidelines does it say that you need to be on menopausal hormone therapy for prevention of osteoporosis.
Mm,
So you are doing all the correct things currently. And you also mentioned the BHRT. I want to have a better understanding of what that means, because there's a lot of
sure.
differences between types of hormone therapy. And I want to ensure that you are on a correct Health Canada approved, safe, and efficacious form of hormone therapy.
Yeah, let's dive into all of those little acronyms: BHRT, MRT, HRT. We would love your thoughts on all of that, please.
Sure. So when we use the word HRT, what we're really referring to is hormone replacement therapy. And
Right.
that is only used for women who have a confirmed diagnosis of premature menopause under the age of 40 or early menopause between age 40 and 45, meaning
Okay.
you are in menopause. You're not perimenopausal, you are in menopause. That means that either you've gone 12 months without a period under the age of 45, or you've had surgically removal of your ovaries. Sometimes women will also have their uterus removed. Sometimes women will still have the uterus, but have both ovaries removed. You can go into menopause spontaneously, and sometimes it can also happen because of cancer or because of chemotherapy or
Mhm.
risk reducing surgery if you have a risk for ovarian cancer. Those women need hormone replacement therapy because this is considered an endocrine deficiency. You are a woman who is lacking the estrogen and progesterone that your body is needing. And so we need to replace that up until the average age of menopause, which is 50, 51. So that is when we use the words HRT. We are replacing what your body otherwise is supposed to be producing. Menopausal hormone therapy is for the average age woman who is using hormone therapy to treat her symptoms.
Right.
So the majority of women who are on hormone therapy are on menopausal hormone therapy. We use the dose to treat the symptoms. Whereas with HRT, hormone replacement therapy, we're using high doses of hormones because we are trying to replace what her body should have been producing.
Gotcha.
BHRT is a marketing term.
Okay.
Bioidentical HRT, essentially, from from what you're sharing with me, is a form of a compounded hormone therapy where you've gone to a hormone doctor or a hormone functional medicine doctor who has prescribed you hormone therapy based on a set of lab work, salivary gland testing, Dutch testing, and then they tell you, we need to, you have low estrogen or low progesterone, so I'm going to make you a custom compounded cream in a pharmacy, and that's going to be, the bioidentical hormone. And that's marketed to women as being safer and more efficacious because it is quote unquote bioidentical.
Right.
And bioidentical essentially means that the hormone that you are being prescribed is identical to the molecular structure of what your body is producing. So the main form of estrogen that our bodies produce in the ovaries is called estradiol. So when you're getting a compounded estrogen, you're getting a compounded estradiol cream or gel, or however it's being made for you in the pharmacy. Now, the challenge with compounded hormones is that these hormones are unregulated. So there is no product monograph that confirms the purity of the product, the safety of the product, the efficacy of the product. Whereas in my world, and when we use evidence-based menopausal hormone therapy, what we are referring to is exactly the same. It's estradiol, but it's not compounded. It is a product which has gone through rigorous trials, randomized controlled trials, where we know exactly what the amount of the estrogen is in that product. We know that it's safe, we know that it's efficacious, and whether you buy it in BC or in the Maritimes, the same prescription is given to the pharmacist and you will be given the exact same product. Why that's important is because as a menopausal hormone therapy expert, if I'm going to be prescribing hormone therapy to a patient, my job is to ensure that the product is safe and that it's going to work. And I need to ensure that I'm not going to increase her risk for an estrogen receptor positive cancer like breast cancer or uterine cancer. So that's why it's very important for women to understand that compounded bioidentical hormone therapy is not approved by Health Canada. We don't have it recommended in any of the guidelines, and that women should avoid using that form of hormone therapy. Any
Okay.
product which is Health Canada approved, and we have many, many different products, are the ones that women should be asking their GPs for, or their OBGYN or their healthcare provider.
I think what scares people, or what perhaps would make us cautious, is that we hear that regular estrogen that's not bioidentical is then made from horse urine. Is that true? And
Yeah,
so what do we think about that? How, like, help us understand how that is safe and better for us than something that is more molecularly similar to what we have.
so just to give you some parameters, some examples,
Yeah.
a large proportion of the estrogen products that we currently prescribe are all estradiol. So estradiol comes orally. We have a Health Canada approved product. It can come in the form of a gel, which is called estrogel or Divigel. It can come in the form of a patch, which is called Estradot. These are all Health Canada approved bioidentical or body identical hormones. They don't need to be compounded. So a large proportion of what we prescribe is already bioidentical. It's not so much whether it's bioidentical or not, it's whether or not it's Health Canada approved. And remember,
Gotcha.
all of these products are still made in the lab. So it's not natural, it's still all made in a lab.
Yeah.
And Premarin is the one that you're referring to. Premarin comes from prem means pregnancy, mare means horse, and in is urine. So Premarin comes from the urine of a pregnant horse. That was the most prescribed form of estrogen back in the 1990s when that large women's health initiative was published.
Right.
And there's nothing wrong with Premarin. It is also a very, very safe form of estrogen. I think that women are being misinformed by the information that's being publicized to them. So you want to be on an estradiol cream or gel? We have that. We have those products, and they are Health Canada approved. They're not compounded. So I can give you reassurance that if you're worried about the safety or the body identical products, we actually do have many forms that are available to you. and also covered by all, the large majority of insurance plans. So you're not paying out of pocket for a very expensive assessment, for unnecessary blood work, and also for very expensive compounded hormones.
Yes, and isn't that true? It's very expensive if you go through your naturopath and have to get it that way. You said something. Okay, now I've heard controversy, of course, about the Dutch test or the dry urine testing. I would love to hear your thoughts on what type of testing should we get or could we get in order to determine hormone level, where they're at, where our hormone levels are at, and which way, in your opinion, is the most accurate? What should we be
Okay,
asking our doctors for?
excellent question. So the first thing is that for somebody like yourself, there would be no indication for hormone level testing because you've just told me you're 54 and I'm assuming you are in menopause.
Yes,
Okay, so we already know that your estradiol level is going to be low and your
right.
FSH level is going to be high. So doing a hormone level test is of no benefit. And for women who are in perimenopause, who are presenting to their healthcare provider and asking about doing, can I get my hormones checked? Where am I at? It's of no value. And that is because the whole nature of perimenopause is fluctuations in estrogen levels. That's why you feel so unwell all the time. And so by doing a hormone level test, you're only getting information about that one particular day.
That's
The
right.
estrogen level can completely plummet the very next day. And so for women who are, going through perimenopause and very symptomatic, there is no need to do any hormone level testing. What is needed is to do blood work to rule out other causes of your symptoms. So for example, if you're fatigued, maybe get your CBC checked, get your iron levels checked, get your thyroid level checked. There could be some other causes for your fatigue. And the only time that there is a role in doing hormone levels is for women who have gone 4 months without a period all of a sudden and don't know why. Maybe
Mm,
that woman is potentially now at risk of premature or early menopause, as I mentioned, under the age of 45. So if you are a 45-year-old and older and you're skipping periods, but you haven't gone a full 4 months, and even if you do go a full 4 months and you're over the age of 45, you are still now in that normal age range of going into menopause. No need for hormone level testing. It's only for women under the age of 45 that you need to go for blood work.
good. Thank you for clearing that up. That's excellent information. Can we talk a little bit about how menopause impacts our cardiovascular health? This is something that is of concern to all of us, of course. I had a heart healthy dietitian on the other day. I thought she gave such great information as well, just to eat for heart health. But what sorts of things are we, possibly looking to run into in terms of our cardiovascular health as we enter this menopause transition?
So estrogen is like a lubricator to our blood vessels. And so when we have estrogen, it actually is very protective to the heart. And many women are nowhere near as high risk of heart disease while they're still menstruating and still getting periods and still have ovarian function. But when we hit and enter into that late, menopause transition and into menopause, there is a drop in estrogen levels, and that has a direct effect on our heart health because we now catch up very quickly in terms of risks of heart disease and as almost as equal as men. And
Mhm.
so I would say, estrogen is like a lubricant to our blood vessels. And as we lose our estrogen, our heart vessels become more stiff. We have higher risk of developing high blood pressure. Our cholesterol levels can increase. Our risk of diabetes increase because we know that estrogen also helps our body to be sensitive to insulin. So when we are entering into menopause, we are higher risk of developing insulin resistance and also higher risk of developing diabetes. So what I think is really important for women to know, and I heard this on another podcast actually last week. It was by Dr. Vonda Wright, who is an orthopedic surgeon, and she talked about how the age between 35 and 45 is the critical decade. And I love that because I think as women, we see our doctor a lot when we're trying to get pregnant, when we are pregnant, and after giving birth, we follow up for our babies' well baby checks, and maybe some contraception, birth control pills. But beyond that, there isn't really much education about what we can do for preventative health care. And so 35 to 45 is really a critical decade where we need to be working on what we can do to protect all of our body systems, our hearts, our bones, our breasts. All of that is very, very important, and we don't get that education. And so I think it's really important that we understand that if we start making those lifestyle changes early on, like you have been, we're going to protect ourselves from developing these cardiovascular risk factors as we get older. So I know that, as I mentioned, if you develop high blood pressure in perimenopause and menopause, you're also now at risk of sleep apnea. So you're now adding risk factor upon risk factor upon risk factor. So I think it's really important for women to understand this information early on in their life so they can start making those lifestyle changes earlier and not to forget to make their own care, their own self-care a priority. This is not a luxury, this is a necessity for us to be able to age powerfully.
I agree. It is critical. JFK says the time to fix the roof is when the sun is shining. And
I agree
never was that more
120%.
true than with
Yes.
our own health, right? Yes. I know that Dr. Vonda Wright came up with the term musculoskeletal syndrome of menopause. And let's just talk about that a little bit. I'm sure that you see so much of that in your practice, women coming in with osteopenia, osteoporosis, carpal tunnel, plantar fasciitis, right? There's lots of different things that can contribute to this syndrome. And so what, yes, of course, there is the prevention and try to do things before, but what if we haven't? What if we're coming into you now and we have some of these things? What's your advice to us then?
So the musculoskeletal syndrome of menopause is very new, right? This was literally only created and coined and published, I think, only 2 months ago.
Wow.
So, to be quite honest with you, there has been really no connection between a 52-year-old who comes in with a frozen shoulder or osteoarthritis and menopause. In the average general health, in the average GP's office, if you're coming in with knee pain, you're going to get an X-ray, maybe an ultrasound. If you're coming in with shoulder pain, you're going to get some sort of imaging. But no one's going to say, oh, this is related to menopause. It's never really connected. And I think this is a very new area and very exciting area because this is not typical. Talking about joint pains is not a typical thing that we connect with the lack of estrogen. But what women need to now understand even more is that we have estrogen receptors throughout our bodies. So it's affecting every single cell in our body. And with more and more research and more information, we're getting to have a better understanding of how the change in this milestone in our life is affecting every part of our body. So, my answer to you is this is still very new and there's still a lot more research that needs to be done. But I think the awareness of it is so important so that when a patient goes to their family doctor's office, they're finally being validated. They're not being told, there's nothing wrong with you, your imaging is fine, see you later. And I think women are just so used to being dismissed when it comes to many of the symptoms that they experience and they don't bring it up, or if they do, it doesn't really get addressed. So I think it's wonderful that there's finally some acknowledgement of validating what women are going through.
So a lot of that you just said is related to our decrease in estrogen or elimination basically of estrogen in our body. So if we want to avoid some of those syndromes, yes, like who wants frozen shoulder or plantar fasciitis or osteopenia? Would it be prudent then to go on replacement therapy or is it some of these lifestyle changes that we can really begin to implement that would also help shift those syndromes?
I think that's a great question. And I always go back to the Menopause Society guidelines, and we do not have current data and research to say that we can specifically start menopausal hormone therapy specifically to treat joint pain. I have seen patients who come in with the typical hot flushes and night sweats. We put them on hormone therapy and their joint pains improve. So, what I'm trying to say is that I think that there is a lot more research that we need to do about the role of preventative purposes for hormone therapy, but we don't have the true evidence, the large systematic reviews that can tell us that we should be recommending this for every single woman for prevention of so many health conditions. I wish I did,
Yeah.
I wish I had the data, but the reality is I need to follow what the guidelines say, and what the randomized control trials are telling us. But it's very hard to do these large trials because it costs a lot of money. A lot of women need to be, enrolled in these studies, and they also are required to be followed for a significant period of time. So it's really difficult to do some of these large studies that patients are wanting and hoping for. Um, my hope is that over the next 5 to 10 years, this space will look very, very different for women. But at this point, and where we are at, we cannot specifically prescribe hormone therapy specifically for treatment of joint pains. And you're absolutely correct. Lifestyle, number one. In any medical condition, even obesity, we don't go straight to bariatric surgery. We talk about making some lifestyle changes, diet and exercise. If that doesn't work, then there is a role for pharmacotherapy. And there are excellent products that we now have in Canada specifically for weight management. And if that's still not, part of the success, that's when we talk about surgery, osteoarthritis, weight bearing exercise. Then we talk about, local steroid injections. We talk about topical therapies. We talk about now PRP and many other new modalities. And if it's still not improving, that's when we talk about replacement. So everything always has a stepwise approach, and we can't always jump straight to therapy, prescription therapies.
Yeah, I really like that. I think that's important. And then, of course, that means being diligent and doing your own due diligence, going to see your physician, having these conversations, and following up with specific testing so that you can ensure, it's not something else, and that it can be treated separately as well. All right. So you said lifestyle factors. I think this is really important, and I'm sure you prescribe this all of the time to your patients. So let's just talk a little bit about specifically in this menopause transition. What type of lifestyle factors are you recommending? What are you telling your patients in terms of their exercise protocol and their nutrition?
I really love that question because at the end of the day, I'm still a primary care provider, even though I don't have a family practice anymore. What I love about primary care is that so much of what we can do is about prevention and starting early, right? What I'm going to share with you sounds like what most women hear, but what I really want to emphasize before I tell you what my recommendations are is that I think as women, it's 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 unique that being a menopause specialist, not only am I treating my patients, I'm also treating myself as a perimenopausal woman. A lot of what we do in medicine is treating disease that we will never ever experience. But it's really quite wonderful that all of us are going to experience the same thing that our patients are going to experience. So when I talk about some of these interventions, I'm sharing it not because I'm just prescribing it to you and telling you what I think you should be doing, but because I am also inhabiting a lot of these lifestyle interventions. And when I do these things, I see what the benefits of them are. And I'm sure you have as well, being so, um, you know, valuing the importance of self care. And so I just want to preface by saying that, first of all, the second thing also is I think as women, we always tend to compromise our own well beings for the care of our families, our children, our jobs, our careers, our parents, and we always put ourselves last. And so when I share some of these recommendations, it's because I really hope that a woman can understand that making herself a priority is so important and that she should never feel bad about it or guilty about doing it. So the first thing is smoking. So there's
Mm.
a lot of good information, excellent information about the risks of smoking. It in your younger ages, you may not necessarily appreciate how this is going to affect your later ages, but women who smoke have worsening skin, worsening wrinkles, hot flushes are a lot more severe. They're at higher risk of developing lung cancer and bladder cancer, and a direct, huge correlate to cardiovascular disease. So if you are smoking, I would highly recommend that that is a big part of your move in terms of discontinuing or stopping smoking. The second thing is alcohol consumption.
Yes.
And I personally have never drank in my life, so I can't really comment on this. But what I can say is that, again, alcohol has, I know for many women, it's a part of our socializing experience. We go out with our girlfriends, a drink or two on the weekends can turn into more if there's more social events. Um, and the previous, recommended number of drinks per week for women was 9. And as of last year, it's dropped to two
Yeah.
units of alcohol.
Yeah.
And that's a huge, huge difference, a huge change.
Totally.
But I think that we as women need to understand that, we are a vessel and we only get one vessel. And what we put into our
Yeah.
bodies is what's going to come out of our bodies. And so if we can really focus on, making some really difficult but very important restrictions in the things that we're putting into our bodies, we are going to have a direct effect on our output. So I would highly recommend really to either decrease your alcohol consumption or stop altogether. I also hear women tell me that when they drink, it also worsens their night sweats. So they sometimes realize that they are intolerant to their alcohol and discontinue it on that basis alone.
Yeah.
The third thing I talk about with patients is their diet. And I'm sure you've interviewed a lot of nutrition experts on your podcast who probably have talked extensively about this. The bottom line is that there is no perfect diet. You're going to hear all kinds of things on social media, and what works for one person may or may not work for you. And so I wouldn't ascribe to any particular diet. What I would say, however, is that the research is really emphasizing the importance of protein intake for women in midlife and in menopause. And we're talking about, and I'm sure you already know this, but zero point 0.8 to 1.2 grams of protein per target body weight. So a minimum of 100 to 120 grams per day. And I tell patients it's really important that you need objective measurements, right? The more information we have, the better the awareness we're going to have, the better choices we're going to make, and better results we're going to have. So using, a MyFitnessPal or something where you're actually tracking what you're eating and what amount of protein you're getting is very important. You don't need to always have it come by meat forms. It can also come in plant-based forms as well. And there's so many ways that you can get your protein. So I really try to emphasize, don't worry about what you shouldn't be eating. Focus on what you should be eating. And when you're choosing the right foods, you're automatically going to make proper and more healthier food choices. When it comes to the exercise piece, I mean, I don't need to tell you, you know what to do.
We do.
It's all about the strength training and
Yeah.
cardiovascular exercise is always important for heart health. It's also really good for mental health. It's
Yes.
also really good for mindfulness. And so, but strength training in particular to prevent the musculoskeletal syndrome of menopause is key. When we lift weights, we are preventing risk of fall. We are preventing risk of fracture. We are preventing risk of frailty as we get older. And so lifting weights is really the bottom line. And we talk about the importance of progressive weight training. So you're pushing higher weights, but also doing it in a way that's safe. I think there's a lot of fear around walking into a gym and seeing all these athletes and not really knowing what to do in the gym. So I really do value the importance of getting a coach or a trainer to teach you how to do this properly. A lot of patients are hesitant to spend the money on that, but I think when you are investing in your health, um, this is very valuable because you don't want to end up causing an injury. So that is another big piece. So alcohol, smoking, weight training, and then the protein. In terms of what we need to do from a senior healthcare provider, it's really important to know what your blood pressure is. It's important to know what your cholesterol levels are, and you also need to know what your diabetes risk is as well, and looking at some of the non-modifiable and modifiable risk factors. So your age is a non-modifiable risk factor, your family history is a non-modifiable risk factor, and whether or not you're in menopause is also. Some of these things we have no control over, but what we do have control over, the more information we have, the better the choices we can make.
Absolutely. That was everything wrapped up into a lovely little bow there. Great, great information. One thing I just wanted to say as you were speaking, I was just musing on the fact that my age group, so I'm 54, we spent our 30s and 40s, maybe 20s, 30s, 40s drinking a lot. That's what we did on the weekends. That's what people got together and drank. And I knew many of people. I remember training one lady who she will call her cocktail Cara. She every day, had a open door at 4 p.m. for people to come over and have a glass of wine. And if they didn't finish the bottle, she finished the bottle. And so she started to gain weight and of course felt like crap and asked me to help her shift this. But it was tricky because her whole social group did the same thing, right? And so she had to make a big transition to shift that identity that had become a habit, right? And so moving towards something that was healthier it took time, and it took shifting some of the friends and the people around her. So that was big. And so that I was thinking, a lot of my age, like I said, are now becoming aware that alcohol is just not great. Right. We've heard lots of science already through different podcasts, and lots of people are alluding to this now, which is wonderful. We're getting lots of good information, but it is going to mean a big social shift, and that is not easy to do. Would it mean looking for new friends? And at this stage of life, who can, that's hard to do. We don't have our children as connections anymore, and so I feel for some of us who maybe are in that pattern, or maybe you have a spouse who drinks a lot and you're thinking, well, I want to really improve my health and stave off some of these vasomotor symptoms and get better sleep. And alcohol like inhibits all of that so much. So I find it interesting, and it's going to be a challenge for my age group to do that, but it's so worthwhile, right? And like you said, you have one vessel, one kick at the can here, and why wouldn't you want to just feel your very best and go through this next part of life, um, having very optimal health and feeling your best? I don't know. What are your thoughts on that?
I do love that. And when I do go out socially, I do love going to a nice restaurant, having a nice mocktail, I guess. My favorite food at a restaurant is always Caesar salad. But now I'm adding more protein into it. But now that, I'm beginning to recognize all this, like if I want to hang out with somebody socially, now I'm more asking about, can we go for a walk?
Yes,
Can
exactly.
we go for a walk and talk rather than sit down and eat and drink? Because actually, that being in the nature feels so good, and you're also, getting your calories in. I wear my Fitbit all the time, so I'm tracking all of that as well. And I guess it doesn't. You don't really know how you're going to feel until you start doing it. But when you
Yeah.
start doing it, even if it's for 5 minutes, the incremental benefits are incredible. And there's this thing called neuroplasticity. When you make small changes, your brain reacts to that. And if you keep going, it is possible. And you don't need to be in your 30s or 40s, even if you're in your 50s and 60s. These are things that we can still do even at a later age.
Yeah, we are really, our friendship group does that. It's no longer going to someone's house for birthdays and just, standing around having cocktails and charcuterie. We're pickleball and brunch. We're hiking, we just have shifted what we do to celebrate those important milestones. And I think, you may not have that group around you, but you can start something. So if you're listening to this and you're thinking, well, I don't have fit friends, why don't you start something, right? You can begin a hiking or a walking club and invite one friend, and then they can invite a friend, and so on and so forth.
Mhm.
I think it's just such an important way to have people around you that influence you in a positive way, as opposed to in a way that's maybe not going to make you feel your best. Yeah.
And I think it's also, I love that. And I think it's so valuable now to have podcasts. You just put your earbuds in, and you can go for a walk even on your own and listen to some wonderful positive people that can feed your brain with so much great information. And sometimes that can feed on itself, right? Like it's amazing how much information is at our fingertips today that
Yeah.
we can access in so many different ways. And the world is our oyster, really. There is
Yeah.
so much we can do, and it just takes that one day where you make that decision and then just move forward.
I, for one, am grateful for that. Awesome. Well, thank you so much for joining us today. This has been very helpful and enlightening for me, especially. Where can people find you? Can they work with you? Where can they follow you? Let us know your handles here on social as well.
So my Instagram handle is Dr. Shafeena Premji, and I'll let you maybe put that in
I'll
the
write that. Yep.
notes. So I am based in Calgary, and I do own two family practices, but I also have now opened up a menopause center. It's called Milestone, and it's in the southeast of Calgary. I receive referrals from across Alberta, and currently I have about a 14-month wait list, so please forgive me. But it just goes to show how much women are looking for help. My consultations are 45 minutes in length, and as I mentioned, it's very comprehensive. I love seeing patients in the clinic. They inspire me, they teach me. When I see them back for follow ups, I'm very grateful for the positive changes that they have made. I share their stories with other women. So you can find me at that clinic. And I am also a board member of the Canadian Menopause Society. We have a wonderful website there with lots of valuable information for healthcare providers as well as patients. And finally, I am also a medical advisory board for the Menopause Foundation of Canada, which is an advocacy group, two wonderful women, Trish Barbado and Janet Coe, who are the co-founders and are really trying to break down the stigma for women in the menopause transition and beyond, and are doing some amazing work with respect to the menopause effects in the workplace. They have a report that they've released last year. They have a lot of resources, symptom trackers, a lot of great information on their website.
Awesome. Who wishes they lived in Calgary? Me. Actually, my daughter lives there. I could come hop over for a visit there.
Come visit anytime. It'd be a pleasure.
Well, thank you so much for joining, everyone. As always, go move daily in your fitness, wellness, and nutrition, and we'll see you in the next Move Daily Talks.